Hey guys, welcome back to my channel. In this video, we are going to study regarding erythropoiesis. So let's see what is erythropoiesis. Erythropoiesis is the process of origin, development, and maturation of erythrocytes. So you all know what is erythrocyte? Erythrocyte meaning red blood cells. If you see this word erythropoiesis, it is made up of erythrocytes. Erythro meaning red blood cell and poiesis meaning formation. So formation of red blood cell is nothing but erythropoiesis, which will include three major steps: origin, development, and maturation of cells. So now let's discuss what are the site of formation of red blood cell, that is site of erythropoiesis. So we'll discuss this in three parts. The first is in fetal life, second will be newborn babies, children's, and growing children up to age of 20 years. So I will write newborn and up to 20 years. And third are adults that are after 20 years. So let's discuss in fetal life. In fetal life, erythropoiesis occur in three stages. First stage is mesoblastic stage. Second is hepatic stage. And third is myeloid stage. So in mesoblastic stage, during the first 3 months of intrauterine life, red blood cells are produced from mesoderm of yolk sac. Since erythropoiesis occur within blood cell, therefore mesoblastic stage is called as intravascular erythropoiesis. Second stage in fetal life is hepatic stage. From third month of intrauterine life up to 6 months, liver is the main organ that produces red blood cell. So 3 to 6 organ is liver. Some cells are also produced from spleen and lymphoid tissue. You can see here in diagram, first 3 months it's your yolk sac, and from 3 to 6 it is your liver, spleen, and lymphoid tissue are involved in erythropoiesis. Now the third stage, that is myeloid stage, during the last 3 months, 6 to 9 of intrauterine life, red blood cells are produced from red bone marrow, and few of the red blood cells are produced from liver also. Majority it's red bone marrow. Okay, so see here in the graph, after 6 months to 9 months, you can see it's your red bone marrow. In newborn and up to the age of 20 years, red blood cells are produced from red bone marrow, from long bones as well as from all the flat bones. After age of 20, red blood cells are produced from membranous bone, that is vertebra, sternum, ribs, scapula, iliac bone, skull bones, and from the ends of long bone. Long bones are humerus and femur. So here you can see in this diagram that after 20, membranous bone are involved in erythropoiesis, as the shaft of long bone becomes yellow bone marrow because of fat deposition, and it loses its erythropoietic function, loses the ability to form red blood cells. Suppose if red bone marrow is destroyed, then spleen and liver again will become the important site of blood formation. Okay, so this was all about sites of erythropoiesis. Now let's discuss hemopoiesis. What is hemopoiesis? So hemopoiesis or hematopoiesis is not the formation of hemoglobin. Rather, it is the process of origin, development, and maturation of all blood cells, all type of blood cells, red blood cells, white blood cells, platelets. So, what are the stages of hemopoiesis? So, as you all know, stem cell are the primary cell capable of self-renewal and differentiating into specialized cell. Here, hematopoietic stem cell are the primitive cells which are present in the bone marrow, which gives rise to different types of blood cell. Hematopoietic stem cell in the bone marrow are called uncommitted pluripotent hematopoietic stem cell, that is PHSC. This cell can give rise to all the type of blood cells. They are not designed to form a particular type of blood cell. So they are named as uncommitted pluripotent hematopoietic stem cell. When the cells are designed to form particular blood cell, they are called as committed pluripotent hematopoietic stem cell, meaning these cells are restricted to give rise to one group of blood cell. So your committed pluripotent hematopoietic stem cell are of two types. The first is lymphoid stem cell and the second is colony forming blastocyte. Lymphoid stem cell will give rise to lymphocytes and natural killer cells. Here you can see it. Colony forming blastocytes, which gives rise to myeloid cell, and this form different unit of colony forming cells. The first is colony forming unit E, meaning the cell of this unit will develop into erythrocytes. So from here to red blood cell, this is erythropoiesis, and we will discuss this process after this. Next colony is your colony forming unit GM, that is colony forming unit granulocytes and monocytes. This cell will gives rise to granulocytes and monocytes. In granulocyte we have neutrophil, basophil, and eosinophil. Then the third colony, that is colony forming unit megakaryocyte. This colony will form or give rise to megakaryocyte and megakaryocyte in written form platelets. So this was all about hemopoiesis or hematopoiesis, meaning formation of all type of cells. Now we'll discuss from colony forming blastocyte, one colony, that is colony forming unit erythrocyte, up to red blood cell. This from here to here is called as erythropoiesis, and we'll discuss this process now. Erythropoiesis from colony forming erythrocytes takes 6 different stages to reach up to the mature erythrocyte. So the first stage is proerythrocyte, the first cell to form after colony forming unit erythrocyte. It is very large in size, about the diameter of 20 to 23 micron in the range. It has large nucleus, so nucleus is present, so I'm writing plus, and it has 4 to 5 nucleoli and the reticular network. Cytoplasm is deeply basophilic, and hemoglobin is absent, but the synthesis starts from this stage, and proerythroblast multiplies several times and finally reach the next stage, that is called as early normoblast. Early normoblast is little smaller than proerythroblast with diameter of around 15 to 20 micron. Nucleus is still present, nucleoli disappear, and chromatin network condensation occur. Cytoplasm is basophilic, and this stage is also known as basophilic erythroblast. The cell develops into the next stage, and the next stage is called as intermediate normoblast. The size of cell still decreases, and it's around in the range of 12 to 14 micron. The nucleus is still present, and the chromatin network shows further condensation, and hemoglobin start appearing in this stage. So I will write plus for hemoglobin. And as hemoglobin start appearing, and due to the presence of hemoglobin, cytoplasm will stain both acidic and basic. So due to the presence of both the stain, this stage is polychromophilic, and it is also called as polychromatic erythroblast. And the cell develops into the next stage, which is called as late normoblast. Diameter of cell decreases up to 8 to 10 micron. Nucleus become very small, and chromatic network is very much condensed, and the nucleus appears like ink spot. You can see here, just like a spot. And the quantity of hemoglobin rises and increases, so the cytoplasm becomes almost acidic. So the cell is now called orthochromatic, because from polychromatic, meaning having two type of stain, it become acidophilic. Only one type of stain is present now, so it is called as orthochromatic erythroblast. And mitosis stops here. The next stage is reticulocyte. Reticulocyte is otherwise known as immature red blood cell, and the diameter of the cell is around 7 to 8 micron. The cytoplasm contain reticular network, which is called as reticulum, that is formed by the remnant of disintegrated organelles, as you can see here in this image. And due to this reticular network presence, the cell is called as reticulocyte. Stain is acidophilic. We have hemoglobin. Nucleus is not there. The next stage from reticulocyte is mature erythrocyte. Here, the reticular network completely disappear, and the cell takes biconcave shape, and the diameter of the cell is around 7 to 7.4 micron. The cytoplasm is acidophilic. Hemoglobin is there, obviously. It takes 2 days for the reticulocyte to become a mature erythrocyte. So 2 days here. And from proerythrocyte to reticulocyte, it takes 5 days. So in total, erythropoiesis is a 7-day long process. Now let's recall important event of different stages of erythropoiesis, and this we have to remember for a longer period of time. So the first stage was proerythroblast. Proerythroblast is also known as megaloblast stage. So in this stage, the important event was starting of hemoglobin synthesis. The second stage is our early normoblast. AKA also known as basophilic erythroblast. So the important event here is nucleoli disappears. Third stage is our intermediate normoblast. Intermediate normoblast is also known as polychromatic erythroblast. So here hemoglobin start appearing. Next stage is late normoblast, also known as orthochromatic erythroblast. So important event to remember in late normoblast is nucleus disappear at the very end of normoblast, like just before passing it to the next stage, which is your reticulocyte. The nucleus gets disappear. Now the next stage is reticulocyte. Reticulocyte is also known as immature RBC. And here important event is reticulum is formed, and cell enter capillaries from the site of production. So very much important to remember that cell enters capillary from site of production. And the last stage is our mature RBC, erythrocyte. So here the important event is that reticulum disappears and cell attain its biconcave shape. So this was the important events during erythropoiesis. Are you able to tell me what are the different changes that occur during erythropoiesis? So the first thing we saw was reduction in the cell size. From 20 micron, it came down to 7 to 7.4 micron. Second change was disappearance of nucleoli. In which stage? Do comment and let me know. And nucleus also disappear in the late normoblast stage. Okay. Third important change was appearance of hemoglobin. In which stage? Are you able to recall? Yeah, this is your intermediate normoblast stage. And the last change which we encountered during erythropoiesis was change in the staining properties of cytoplasm. From deep basophilic, the cytoplasm changes to basophilic, then to polychromatic, having both the staining acid and basic. And then in late normoblast, it got orthochromatic, meaning acidophilic, one type of stain, and it remained acidophilic till the end. So these were the four different changes that we saw. And now we'll discuss factor necessary for erythropoiesis. We discussed these factors under three different headings. The first is stimulating factor, second is maturational factors, and third, factors necessary for hemoglobin formation. In stimulating factor, we have hypoxia, then we have erythropoietin, third hormone is thyroxine, hematopoietic growth factors, and we have vitamins, vitamin B3, vitamin B6, and vitamin C, D, and vitamin E. For maturational factor, we have vitamin B12, we have intrinsic factors, and folic acid. Factor necessary for hemoglobin formation. So we have first class protein and amino acid. Then second we have iron, very much important for forming hemoglobin. Then we have copper, cobalt, and nickel. And we have vitamins, vitamin C, B2, B3, and vitamin B6. So these are various factors. Now we'll discuss hypoxia. Hypoxia is a state of decreased oxygen availability at tissue level. So it will stimulate kidney to produce erythropoietin. Erythropoietin hormone will in turn stimulate red bone marrow to produce mature red blood cells or erythrocytes. An interesting factor which was recently discovered is that during hypoxia, a transcriptional factor called HIF, hypoxia inducing factor, is involved, which activates transcription of gene to produce substances from protein including erythropoietin. This was all for this video. Thank you for watching and consider subscribing.